My mother grew up in New York City and Harlem in the 1950s. Her father was a physician and a surgeon at Harlem Hospital. I only knew a little bit about this part of my mother's life, so I asked her to tell me more about it.
Well, as you know, my family was the first family to move into our building. I was, I think, about 2 years old, and that was my world.
My grandfather had a cousin who was a doctor living in North Carolina. Cousin Albert had more work than he could handle, and he asked my grandfather to come south to help out. So my grandfather moved his family to sleepy Wadesboro, North Carolina, where he worked as a local country doctor.
My time in Wadesboro was very different than my time in New York. Most of his clients were very poor. People paid him in corn and butchered hogs, and so we had lots of food. My bedroom faced over a highway, it's up on a hill, and one night, all of a sudden, I see on the highway, all these cars in a row, and there's a trail of white sheets. I didn't know what the Ku Klux Klan was, but I knew that everybody in the house was afraid. And one night, the sheriff came. Albert poured drinks. They sat around chatting for a while, and then they took him away. He was arrested. He was arrested because a white woman reported that he had performed an abortion for her.
I never knew about this part of my family history. I knew that the issue of abortion in America has always been racially charged. But until I started making Trapped, my feature documentary about abortion, I'd never really considered how the experience of having an abortion might be different for Black women.
My friends, it is a baby! It is a child!
According to the Center for Disease Control, Black women have abortions at 5 times the rate of white women. Certainly the reasons are complicated, but experts point to barriers like a lack of access to education, reproductive health care, and income disparity.
You pretend to be a Christian. When are you going to come back to Christ?
Dr. Parker, much like my grandfather did, travels across the South, providing women with access to medical care, including abortion. He's become a well-known advocate for access to abortion care.
They're trying to wipe out the black race, if you've noticed. They're trying to wipe them out.
I was prepared for protesters, but it was still shocking to hear the protesters call Dr. Parker a filthy Negro abortionist. They were even disgusted with me for my position while making this film.
Are you pro-choice? I
am pro-choice, yes.
It's easy to be pro-choice because you're not the one being killed.
Yeah,
that's
right.
all I
Amen.
have to say.
Oh, yeah. What do you got to say to that?
That's all I have to say.
Hey, were you pro-choice about slavery, too? Because that was a privacy issue back in the 1800s. You pro-choice about that?
You think slavery and abortion are equivalent?
You pro-choice about slavery? Dred Scott, all that?
I don't understand your point.
Good job.
Was I pro-choice about slavery? I just wonder why you keep injecting race into the conversation.
Because we like black babies. Black babies matter to us, but apparently not to you. And you don't care one bit because you're pro-choice. You stand beside those folks. Good job. Good job. You're a disgrace to your race. You too, bro.
It was absolutely surreal to hear older white men lecture me about the impact of abortion on the lives of Black women. Meanwhile, I was interviewing real women inside the clinics, hearing their painful stories and how hard their choices were. It made me realize just how infrequently Black women's stories are really ever told.
with today's date in this blank, you're going to sign a date here. Nobody is forcing you to have this done. You do have 48 hours to change your mind. We did an ultrasound to find out how far along you are. You are less than 19 weeks pregnant. Do you know what your blood type is?
No.
Okay. Questions?
No.
All right. Is there a reason why you didn't give me an emergency contact?
I don't have family here.
Okay. Anybody? Friend? Church member? Boyfriend? Nobody. Okay. On the day of the procedure, you're going to have to give me someone, and it doesn't have to be someone in this vicinity, but if something happens to you here in the clinic, I need to be able to notify someone, okay? So whether it be your mom, if she lives in another state, that's fine, but I need an emergency contact, okay? And what are you going to do as far as a driver on the day of the procedure?
A cab, maybe.
Okay. You're going to have someone with you. I can't put you in a cab sedated with someone that you don't know and that I don't know.
Okay.
What we can do is talk to the volunteers maybe. Sometimes they will assist if you don't have a driver, because I'm not comfortable sending you with someone that I don't know.
I'm 20.
What do you do?
As far as work?
Yeah.
I'm a cashier at Walmart.
Okay.
I make $9 an hour. Being a single parent is not easy. I'm studying to become a paramedic. I just feel like with another child and what I'm trying to do right now, I don't feel like I can do it. I'm just trying to pursue my dreams so I can just have better for my son.
How old is your kid?
My son is 19 months. He's a great kid. I just want to take care of him, and I don't really think I can do a second child not by myself.
How do you feel about your decision?
Like a bad person.
Say more about that. Why do you feel bad? Are you a religious person?
I try to be.
What does your religious understanding say to you about abortion?
I know that God don't want this from me, but I did pray on it. I just want him to understand that I feel like I should go through with it.
Mm-hmm.
I just want him to understand, and I don't want him to be upset with me, because if I do it.
10 years from now, what I would want for you is that you be able to say, you know what, that was a jacked up situation, but if I had to do it all over again, I'd make the same decision, because I made the best decision I could make. And that way you don't have to second guess yourself. And nobody who's walking in your shoes can question you, because they're not in your shoes.
I'm not a good person at all. I just feel like a bad person, a bad female.
Okay, the only rule I'm going to give you is you may not say I'm not a good person anymore, because that is not the case. An unintended pregnancy is an unintended pregnancy. That's all it is. That's all it is. So, no more.
Okay.
Okay? I'm not kidding.
As crazy as it sounds, I said, well, I would rather an abortion than to give the baby up to a family I don't know. Because when I hold it, then that's love. And I don't want to, I'm not going to give that love away.
Deciding to have an abortion is never easy, but in many places, it's also incredibly logistically difficult, especially for Black women. In June of 2016, the United States Supreme Court determined that so-called trap laws, which have resulted in the closure of so many abortion clinics, are illegal. But there is still only one abortion clinic in the entire state of Mississippi. Luckily, there is also one woman there who always listens.
I live in Jackson, Mississippi, and work at Jackson Women's Health, an abortion clinic. Getting ready to walk through those doors is the hardest part. And she's probably torn so many different directions. By the time she gets to me, she's fairly sure of what she needs to do for herself. A lot of the private counseling that I do, I hear interesting stories, and most of them is about being torn one way or another. My name is Betty. Everybody around here calls me Miss Betty. And what I do is I am available to you to talk to you about whatever's going on with you. What we usually do is do a group counseling where I tell you what to expect on surgery day. For me, being a mother is everything. Not only am I a mother to my 2 boys, I'm a mother to the rest of the women in this clinic. I think the protesters think that these women just get up in the morning and decide to go have an abortion when they have put their heart and souls into their decisions and have to walk through that gauntlet out there to even come in and discuss with us the process. Oh, I hate to think about what will happen to the women of Mississippi if this clinic closes. It's tough for women right now.
Miss Betty is like a mother to her patients. But over and over in the 3 years of making the film Trapped, I heard so many women tell me about their shame and how they felt they were letting their own family down, particularly their mothers. And even though I was making a documentary about abortion and interviewing so many women, I realized I'd never asked my own mother if abortion had impacted her life.